Joining us now is Okpe with stories trending around the world today. Good morning,
Good morning,
Oji.
Leila.
How are you?
You look beautiful.
So do you. I love these colours on you.
Good morning. Hi, Dr. Abati. How are you?
I'm good. Thank you. Good to see you.
You too. Well, good morning to you, viewers. We begin what's trending today in Nigeria. Last week, the Lagos state government issued a stay-at-home directive to residents in order to curtail the spread of the novel coronavirus. The governor of Lagos State, Babajide Sanwo-Olu, unveiled an economic stimulus package for the most vulnerable in the society. The stimulus, which comes in food packs, is aimed at cushioning the effect of the 14-day stay-at-home directive for about 200,000 low-income families in every local government area of the state. According to the state government, each household should receive a sealed 5-kilogram bag of rice, beans, and cassava flour. However, a video of a man lamenting about the shortage of the said food items have now gone viral on various social media platforms. Let's take a quick look.
The government of Lagos State, this is what they pick. They pack people inside their houses for a good two weeks, that we should not come out and find what we are going to eat. Look at the rice that they bring it to us, that we have to be at home. This is, we cannot even call it a jerrycan. It's not even up to 1 jerrycan. Now they are telling people to stay at home, that we should not go out and find what we are going to eat. I don't know which kind of government that we have in this country, and whereby we have a billionaires that donated billions of naira to share it and to let people to stay at home. And now tell me, with this kind of food, are we going to stay at home without money, without anything, that we should stay at home and eat this kind of food? This is a right that they are sharing, that we should stay for the good 2 weeks at home. So please, I plead to the Nigerian government and the federal government of Nigeria to please find way out of this COVID-19 emergency food response, please.
This is not the solution.
This is not the solution. Let them find another way out, please. You cannot keep a family man with his children. Let's say we have, like me now, I have about 8 children. Now you give me this kind of rice to eat with my children. Why can I come to cook? I don't have anything to do. Apart from when I go out, I find what to eat. Now they are telling me that this is a rice that I should stay home with my 8 children, 2 wives. That is making a population of 11 families. Now to eat with the same amount of rice. Please, let the government of Nigeria please wake up and protect for this thing. And let us wake up and guard this COVID-19 emergency food response, please.
Well, it seems like some sort of conspiracy. I mean, first of all, a lot of people are saying, how come he has that many wives? But that's not the issue. It looks like that one bag.
What is the problem? He has only 2 wives and 8 children.
And 8 children. What's the problem with that? Okay, well.
With what money? That's where the problem is.
Well, first, I see the bag, the one bag that looked like it came from the government, correct? I mean, it was, he says 1 bag of rice, 1 5-kilogram bag of rice, another 5-kilogram bag of beans, and cassava flour, which is gari.
That's
right?
the version of the government.
Of the government,
that is 5
correct.
kg.
Right.
But what he was showing, or what was being shown on the screen, doesn't look like it's
up to 5 kilograms. It doesn't look like it's up to 1 kilogram.
Which one? The big one or the little
the
bag?
little black
nylon bag. It didn't seem. How would we know if that was from the Lagos government?
Well, that's his claim.
That's his claim.
So the government should investigate it.
Yes.
And the state government, Lagos state government, has said, look, we give 5 kg of beans, 5 kg of rice, and it's in a pack that is properly branded, whatever. I mean, Lagos has a population of close to 20 million people, or thereabouts. So, and the state government is also overstretched, it's overwhelmed. And the state government is also, like other states of the federation and the federal government, trying to learn how to cope with this situation. What people can take away is the fact that, look, the government is showing concern. At the same time, they are providing isolation centers. They are trying to mobilize private sector support. And at the same time, trying to create food banks where they can give something to people. The man who has 2 wives and 8 children, who is protesting, I mean, government is not going to feed every mouth.
And they also said that the household was for 4 children. But yeah,
for
2 people and with 4 children.
Yes,
correct. Yes.
So, you know, I think people should appreciate the efforts being made by government. But government also should make sure that there is no corruption, that the officials involved are not the ones taking all the rice and beans for their own families or associates or relatives.
Well, I looked further. Meanwhile, the Lagos state government has released a video of the COVID-19 emergency food response distribution that took place in Okpe, local government area of the state. Let's take a quick look at this one video.
gómìnà Babátúndé Sanwó-Olú òun ló ní ká fún yín o rẹ̀ ni. A ti ṣe àṣẹ̀dálẹ̀.
Okay, but I'm sorry to say that 16 bottles of water is not going to last 2 weeks. And the government are doing their very best, and they should be commended for what they're doing here. But I think there's also a bigger issue, especially when you look at the first video that you showed of that man lamenting about having 2 wives and was it 8 children or 6 children? 8 children. And it raises a completely bigger issue of the fact that do you really expect the government to plan for a family that big? People are having children that they can't even afford to feed themselves.
Right.
And then complaining when the government can't afford to feed those children for them. So I'm sorry to say, but
anyway,
yeah.
What government is providing is assistance.
Yeah.
Government is not saying that it will carry every household because there will be some people who have 2 wives and 10 children or 3 wives and 15 children.
Yes.
It's just a form of assistance, and people too should adjust at this time because it's a period of austerity. And people are reacting in different ways. And I think that's why UN Secretary General Antonio Guterres, in an interview with Arise News yesterday, said, look, we face a humanitarian crisis, poverty, hunger, lack of access to basic things. But I think as we go forward, government will continue to make efforts, and all of us can make efforts, private sector, individuals. If you know the kind of pressure that people get these days, people requesting for money to be able to survive. I don't know whether you face that kind of pressure.
Absolutely, of course.
But I've seen it, I've observed it. So
It's horrible.
Well, still in Nigeria, let's take another story. The Oni of IFE has sparked arguments on social media after he made a claim that a combination of some natural herbs can cure the novel coronavirus. The monarch has taken to his social media page to share a video where he explained how several natural herbs like onions and African pepper, among others, can be used to treat COVID-19. The Oni's claim, which remains unconfirmed, comes despite warnings from the World Health Organization on the use of spurious methods to treat COVID-19. Let's take a quick look at that video he posted on his Twitter.
This is alubosa, in Yoruba popularly known as onion, with botanical name allium cepa. When sliced and placed at angles of the room, they kill negative energy in the room and harbors positive energy within the room and the entire house. 2. When sliced and placed underneath the feet, with the help of socks, they neutralize and suppress all sorts of virus from the body and also strengthen the immune system. Bitter leaf, sulfur, aridon leaf, African pepper, Guinea pepper or Negro pepper, onion. These 5 materials are pounded together, spread into the hair for it to dry off. To make an incense, prepare a coal in a turbo. Put the incense product turari into it and use the smoke to cleansing the environment.
Well, I mean,
Okay, let's just quickly take some reactions before we go. The Oni, in a flurry of tweets, one of them read, I'm also currently working with Yem Chem International, which is an alternative medicine expert pharmaceutical company, for the packaging and distribution of these globally. It's about time to save the world now. Tomorrow may be too late. In response, one Dr. Fumi said, these claims are wrong. The Oni is not a medical doctor or a virologist. This is an abuse of office to mislead and inform the public. You will never hear the Queen of England, the Sultan of Brunei, the King of Saudi Arabia, or the Emir of Abu Dhabi say such dangerous nonsense. Another user wrote, the last time Donald Trump said chloroquine can cure coronavirus, you all clapped for him. Oni is giving us some traditional herb hint to cure the virus without asking for money. You all are saying he's misleading the public because he's from Nigeria. ungrateful Nigerians.
I mean, the only is not necessarily that far off to suggest that way before the time of pharmaceuticals, our ancestors relied on our own natural remedies to cure certain things. I mean, I was even telling Doctor last week how I was taking a couple shots of dogoyaro in the morning and evening, even to just help with boosting my own immune system. So I don't necessarily think he's wrong to come out and speak on alternative medicine. Where I do think he could have gone wrong, or where I do think he's wrong, is to suggest that this is now for the package and sale of curing something when it's not. I mean, I don't really think he should be that ridiculed, but I think that was quite far stretched. It's the same way a Nigerian doctor came out to speak about chloroquine and how chloroquine could be a possible cure for coronavirus, and everybody mocked him until Donald Trump stood up to give his own country an address, and all of a sudden Nigerians over here were reported as overdosing on chloroquine. You know, so I think it's one of those things where he has a point on alternative medicine. I wouldn't argue with that, but to go and package it like that was wrong.
Well, the main problem, of course, is that everyone is overwhelmed, everyone is shocked, everyone is anxious, and people, either they are traditional rulers or whoever they are looking for all kinds of solutions. So it's not out of place, as you have argued, to talk about maybe there are possibilities in the area of alternative medicine. And the truth of the matter is that there are persons who believe that alternative medicine can help. And that's why you were taking neem leaves, trying to see how you can use it to boost your immunity at this time when you don't know what will happen. I think what is really wrong with what the Oni tried to do is going public with it.
Exactly.
If there is traditional knowledge, alternatives that can be suggested, given his position, he could have talked to the authorities to say, look, yes, we had a Olojo festival in December 2019, and the Oracle suggested these options and predicted that there will be a COVID-19 crisis in the world. And the Oracle also suggested this solution. Okay. It will be for the Center for Disease Control and other experts to look at it and say, well, thank you very much, the Oni of Ife. Let us test it. There should be clinical trials. Because the danger here now is that people will now begin to look for onions. They will be looking for aridon. They will be looking for incense. When the recipe, the solution that this traditional ruler has recommended as solution to this zoonotic, this pandemic that we face, has not been tested.
I totally agree with you, Doctor. I mean, this is a very serious virus. I mean, it has taken thousands of lives across the world, and it is very irresponsible for you to go out in public to give such claims, especially when the World Health Organization has
that's a very strong word. As a Yoruba man,
I'm sorry. I
cannot call the Oni of Ife irresponsible.
I didn't say he was irresponsible.
I just don't use that word.
It was an irresponsible.
He's expressing concern.
You know what it also reminded me of? I don't know if you know about, even with turmeric and how Indians used to use it as an antiseptic, and then two American men tried to patent turmeric as an antiseptic, and Indians were like, hold on, we've been using this as a cure for years, So I would never knock alternatives, personally. But yeah, I agree. He was wrong.
All right. Shall we take a final story?
You took neem leaves and...
Yes, now.
There are alternatives. You do it within your confines. Don't go out in public and deceive people and have people die. That's why it's irresponsible, really.
Especially from him.
Yes. Let's take a final story.
You're very stubborn about that.
Let's head over to the U.S. now. CNN anchor Chris Cuomo announced on Tuesday that he has been diagnosed with COVID-19. Taken to his Twitter page, Chris wrote that he's feeling well and will continue to anchor his 9 p.m. program, Cuomo Primetime, from his home. He went on to say that he had been exposed to people in recent days who had subsequently tested positive, and he hoped he didn't give it to his kids and wife, Christina.
No, this made me so sad.
I know,
I love Chris Cuomo.
I know. I love him so much.
Thank you so much.
Yes, that's what it goes to show. We're all vulnerable.
Thank you very much, EJ.